lots of safeguards when you're going into the OR that before we were cut, they stop everything and they go, okay, this is Mr. So-and-so, we're planning on doing a left total knee. They've been given antibiotics, the implants are here, the doctors are here. No, there's a whole checklist now to prevent wrong site surgery. So you know as you're going through the case, you want to be seeing left here, left there, and so I mean, but you know, it's easy to do. So go ahead, repin. Sorry, my bad. This whole knee's going to take us a little while. Good? There you go.
Yeah, Scott, how long does it usually take to do one of these surgeries?
Go ahead. People that do these routinely can do them in 45 minutes. I think at that point you're not paying attention to the finer steps and you're just kind of slapping it in together. But also the people that are doing that that's all they're doing. And so everybody on the team is set up to where everybody that's doing this, the nurse knows how to do the case just as well as the doctor, and she's giving him what he needs, and it's clockwork. So for me, it takes more like an hour and 15 minutes. So this is our saw.
And while you're doing all that,
yes,
how much would a patient pay to get his knee replaced?
Generally, their insurance pays probably on the order of $50,000 to $80,000, probably $50,000. The implant itself is on the order of $4,000 to $5,000. There's hospital cost. There's my cost of I think $1,200.
So you get $1,200 for doing a surgery like this?
Something like that. They used to, interestingly, get paid about $5,000, but with continued cutbacks in medicine, that has continued to decrease, and so all the old timers in medicine. And this is our saw, and it can hurt you.
I hope not.
Be careful.
Alright. Trying not to hurt you.
Right. So we're going to cut down through this guide and trim the ends of the femur off.
Just don't go on that.
Yeah. And sometimes when you get to these pins, it bottoms out. So sometimes it's beneficial to turn your hand upside down. So, right, it did, but you gotta aim it to get both sides. You gotta work this blade around. It's not that wide. Again, this could hurt both of us. Keep going. That's one way. So work your blade over this direction. You turn your hand back over like you like it, and then I'm going to turn this around like that.
Yeah, if you're in surgery when this is going on, you hear this sound. There's chiseling, there's hammering.
You gotta get it right on.
You think you're in a
this
carpenter
is a guide,
shop.
so it wants to put that blade specifically. There's very little tolerance, and there's a very close tolerance. So if it's binding and not wanting to go, it's your angle here. So back it up, start your blade, and then make the pass off at the end of the. Good. So you see where you knocked off that other side.
You can trim it up.
We'll finish it up for you. The whole time we're doing this, you're also having to deal with, in a real knee, the kneecap and the other soft tissue component. So it does become a little bit of standing on your head. Things happen. So that was our first cut, and again, it was designed to take about 8 millimeters, which is about the size of the end of this component, to come back, and you're going to eventually replace this end, the end to, you're eventually wanting to cut off what you're replacing with metal. So, who's next? Anyone? Emily? You've done this already? You don't know what your dad does? Surgery?
I've never seen like the in between. I've just seen the before and
The before and after pictures?
never the in surgery.
Emily, you need to get up here and tell your dad that you did a soft. You don't
Wouldn't
want
believe
to?
it.
You don't want, okay. You wouldn't believe it? We got a video. We'll video and
All
send
right,
it
we've
to
got
you.
proof.
Anybody else want hands-on, get up here. If not, we'll go let these students continue with the procedure.
So, interestingly, I realized that I asked my striker, my rep, if he had access to the sawbones. He said, yeah, I'll get them in. I don't have the ones for the actual. There's a nice jig where I don't have to hold it. It just sort of stands up there on its own. And then he simplified his set, so I didn't have to bring in 8 cases. Last time I brought them in, they were like this high and weighed a ton. But unfortunately, he's given me only right-sided blocks, and because to do a total knee or total hip, there's a tray that has 8 of these in it that are 8 lefts, 8 rights, and that's to get all the sizes for each side of the limb. And so that takes up a lot of room. So to simplify it for me, he just gave me what I needed. These blocks are these are always size 4, but he gave me the rights and we have lefts here. So maybe I should have stuck with the, we can carry on though. So who's next?
You guys go again.
Come again? So I'm looking for, I don't see a little hex head screwdriver. Okay, so you hold. So is this painfully slow? Or any questions out there?
How long have you been practicing?
How long have I been practicing? I've been out 5 years.
And you still have med school loans?
Yes. I went to Charleston. I think that was 4 years. I think I took out about $30,000 a year. So I finished with $30,000 to $40,000 a year. That's living expenses and tuition. I think tuition was $18,000. I think. So I had about $125,000 to pay back, and you can defer those until you're done with your residency. All right, so should have brought all the 8 sets. Size 5, good. So usually we pin here. I think we can get away without it. Switch this back over. So again, when you're doing this, you want to start at the front and sort of dive through the backs as well. Okay? So this block gets us to this sort of octagonal shape here. To cut off the very front and the very posterior and then little corner cuts. So,
Alright.
so this one is straight across.
Alright. Like that?
Yep. You clear your hand there.
Clear my hand?
Yeah.
Out?
And then, yeah,
Like that?
yeah, except when you come all the way out,
Mm-hmm.
it's, you want to be sawing and then dive in. So you don't want to just reach over without having taken this corner off. So come all the way out that way and then, yeah, dive back
Okay.
in. Out, back out.
Alright.
And it's just, your sleeve, yeah. Except, this is the saw part.
Mm-hmm.
Let me show you.
Alright.
So it's running before I ever get there, and then dive through, Got it? Alright. So, go for the back side.
Alright. Alright, like this?
Soft tissue would just be naked.
Right there.
No,
No, the blades are so there you go in, you guys jab at it, while I like went in and then try to cut across.
Okay.
That's why you threw a shot.
Like that?
Alright, you mind if I finish it up for you? So, alright, so then we do the chamfer cuts, which are these here. So, to keep the injuries and the boredom to a minimum, we will go ahead and just talk you through the rest of it. So, here's what you end up with, is this octagon shape. Now your femoral component fits fairly snugly on there. This one needs a little cleanup cut here. You pound that in. Check the fit. When you're done, you've made a perpendicular cut to the tibial axis by attaching this jig to the front face. You line this up with the long axis here. And it's got a clamp that goes on to the ankle. You pin it, you saw off the top of the tibia, then you have your tibial trowel, and you actually have your sizer guide, you match it up, you eyeball it to see check the fit. Then you have your trowel, it drops down into the tibia, and you have your plastic spacer, it clicks in to the tibial component, and then you trowel that motion where this is rubbing, these are now your two new articular surfaces. When you're doing the surgery, you check the ligament alignment, and the alignment in the joint space, you want it even. You don't want it jacked way over to one side because that's, not aligning up your mechanical